Of course, because we do have experts in the house, so we'll love to welcome Dr. YONG, JUNINA FADZIL, who is consultant, pediatrician and pediatric cardiologist, and also Ms. ROZANNA M. Rosley, who is a clinical dietitian.
Hello.
Welcome to the show.
Hello. Hello.
Ladies, this is a topic that I have never heard of before. I didn't know that it's a bit of a serious issue. I wonder maybe you can tell us, doctor, what is the situation of stunting in children in Malaysia currently?
Actually, yes, nobody's talked about it much because in the past, if somebody was short, as you said, in school, you know, people will call you cute. And at the end of the day, you're going to say, yeah, my parents are not so tall, that's why I'm not tall. But believe it or not, it is a problem because worldwide, we find that Malaysians are actually shorter than a lot of our neighboring countries. For example, we actually rank number 3 in Southeast Asia in terms of height. The tallest being Singaporeans, with an average height of about 171 centimeters. Next come the Thais, 170, and then comes us. The average height of a Malaysian man, is 168 centimeters.
I see.
And the average height of a Malaysian lady is 157 centimeters.
Oh, okay.
And
so,
it's got far more reaching effects than just being too short to reach the coffee jug, the coffee mug, or the pots and pans in an apartment, you know. There's more to being short than just that.
Right. So maybe you can tell us a bit, Ms. ROZANNA. Maybe there is something that is going on that we do not know. I mean, what causes stunting in children?
As a clinical dietitian, we see children from, say, newborn to 6 years old to 1 year old. Then we have the tiny tots, we say, the 1 to 3. Then we have the preschoolers. Then we have the adolescent, yes. So as Dr. Yong has mentioned, the stunting, we will know when we monitor. So monitoring is important. Yeah, you have to monitor their weight, their height. Normally you have the buku pink or buku biru. Yes. So you monitor with vaccination. So there is like, okay, we follow the birth weight. Sometimes if the mother has the pregnancy has, say, complication, or the mother doesn't eat properly, so you have a smaller child or child being born smaller, so that can also be poor catch-up growth and leads to stunting.
Right.
Yes. So others could be the child at 6 months they start solid food. Maybe the diversity is not enough, or the intake is not enough, or too much milk normally. So they lead to not much of variety in terms of solid food. Then when they become one where they reduce the milk or less breastfeeding, so if they continue not to eat a lot, so that will be the beginning of the pickiness, and then you start school, you're sent to Taska, you're sent to preschool.
And the food is provided
yes,
there itself,
and then they wake up very early and so forth. So the whole children go through a lot of changes, a lot of even physiological requirements are different. So we start from young, I think. The monitoring part is very, very important.
I see.
But doctor, I want to ask you, because just moving back a little bit, we've talked about this. We've said that this topic is something that we've actually never thought that we would come off on the show and talking about child stunting and whatever not. And a lot of people actually don't know much about it as well. I'm pretty sure our audience at home. So doctor, can you tell us a bit of what are the misconceptions behind child stunting, or what that we don't know of?
A lot of people think that your height is determined purely by genes, which means if your parents are not so tall, they don't expect their children to be tall, and they become complacent. And a lot of parents, while they take their children for vaccinations, don't actually pay a lot of attention to the growth charts, feeling that, if my child's moving as he should and developing, then all is well. And a lot of misconception also lies in the fact that parents feel that just giving them milk or giving them food in general is sufficient without actually delving deep into what Ms. ROZANNA mentioned earlier, the nutritional content of food and other aspects of childhood and life in general. Adequate sleep, adequate rest, adequate exercise, a loving and comfortable home, you know,
Environment.
the environment is as stress-free as possible, if that's possible.
Seems to be a bit impossible at our growing age environment at the moment.
And I love to be wrong about that, because I've always thought that, because I am 163. I mean, I'm only 5 centimeters short of the average height of a male man in Malaysia.
I think I shouldn't mention mine.
But I've always been considered as short in school. I remember being in school. I wasn't bullied, thank God, but I was always considered as one of the shortest, you know. But I've always thought that it is because of my parents are short
Correct.
too.
Because I also have, my parents, I wouldn't say tall. My dad's actually quite slightly shorter than my mom as well. So we've always had the misconception that, oh, it's genetics, you know, since our parents are short. And my parents, I would say, they think the same. I think the older parents, older generation-based parents, you know, they think the same way as well. You know, I'm short, so I'm pretty sure my children are going to be at the same height. So yeah, I get where you're coming from, actually, Nabil. Yeah.
And apparently, it's actually 20% is only 20% is from genetics, and the remaining 80% is from nutrition. So I want to ask you, Ms. Rozanna, are Malaysian kids eating well? I mean, are they getting good nutrition?
It also depends on who's feeding them, who's feeding them, whether they were, started off the solid food as the right age, progress on age-appropriate foods. Balance is important. I brought my plate.
So maybe you can tell us a bit about
Yes,
it.
it's important. The dairy plays a part at an early age. Breast milk, a formula if the mother is not available. Iron fortified is important.
Right.
Yeah. This comes with vitamin D. It comes with calcium also. That's all important. Yeah, very important. Then the protein part. Yeah, the right amino acid. Iron comes from here. So sometimes if you have a child having only this and this or this only, kan, kata nasi kosong or pasta kosong, they won't have the other micronutrients for growth. So the misconception is like, oh, makan nasi dengan ayam cukup.
Yes.
Yeah. But the energy, the total energy and the other nutrients comes from the rest. So if sometimes the child drinks this first, kenyang lah. So you tend to be full already. So it's important to get the balance of it. So I mean, sayur, sometimes they're picky. They like the same food. So back to exposure, back to role modeling. They normally eat by themselves also. Yeah, so they don't see the parents because they are in school, and peers are the children when they are school age. So it's important back to getting the right balance and age-appropriate development, because when you see the child spoon-fed against holding something, that's also delaying the child to develop, to hold, to touch, to learn, to adventure. So they then tend to become more selective because it's only given this in one way. Yeah.
But then again, because like you mentioned, you know, some of the children, they like vegetables. They're quite picky. There are certain foods that what would you tell, you know, like say a parent comes in and say, my child doesn't want to eat vegetables, my child doesn't want to eat fruits. What can I do? I also have my nephew as well. He doesn't like fruits. Yeah, he doesn't like fruits, but he would take orange juice every night. Yeah, just for my mom, my sister would make just for vitamin C for his body. But then again, what would you tell for parents who come in and say, my child doesn't want to eat this, I'm concerned of the growth, you know?
So normally if they don't eat fruits and veggies, they're also a risk of constipation. So sometimes, you know, and you hear about probiotics a lot, and these fuel is the prebiotics, which are the fruit, vegetables and things. It makes the balance. So the fruits and veggies are part of the micronutrients that help absorb the other main nutrients for growth. So when you don't have the fruits and veggie part, you won't have good growth.
Right.
The calcium will be less, the B vitamins and things like that. So I would advise maybe start from the very young, where they don't know. It's like a blank canvas, kan? So, and then if you don't like, you just like, oh, sedapnya. Sedapnya, that kind of thing. Oh, this is very nice. And the parents role model, the whole environment role model, the school, nowadays we're going to have, we have programs in school, in TASCA, early education development, to look at, okay, balance is important. To expose is important. pressure is important, role modeling is important. So
Technically,
maybe
like
hidden.
positive
You
conditioning
can
them, you know?
try it with
Yeah.
hidden ingredients, we
Yep.
say. Hide it first, you know, hide the veggies. If you don't like green, there's so many other colored, white color vegetables. They normally like carrots. All right, Dr. Yong?
Yep.
Yes.
And also parents
Yeah.
must eat
Parents must eat.
the vegetables. So
Yes.
the first question I would ask if they say my child does not like veggie is, are you eating vegetables? And in large number of cases,
Yes.
the parents say, no, I don't like that.
If you think children are being selective, parents are more selective.
Parents can be selective too, and it's funny because it's bringing me back to when I was young. Now
Now we know the cost.
no, because now I can see it. The reason why I am 163
Yeah.
is because I used to hate vegetables.
Oh dear.
I just started eating vegetables like less than 5 years ago, to
Okay,
be
that's
honest.
interesting.
Maybe that's why my height is like this, which is very, very sad, I would say. But Dr. Yong, I want to ask you, because when we talk about stunting in children, I'm wondering, are teenagers affected as well?
Actually, they are. Because, you know, they found that on average, our Malaysian teenagers are about 6 centimeters shorter than their peers in developed countries. And that they may have had good growth in the beginning because their parents were giving them good food. But as they approach adolescence and they become more independent in their food choices and decisions, they also try to model after their idols, be it boy bands or actresses and other figures. And they try to curtail their intake according to what they believe is right. You know, because social media is so rampant nowadays, they can actually search up stuff. And that may result in them not actually taking proper food. At the same time, they're staying up late, they're not getting enough sleep for whatever reason. One hopes it's studying, but it's not always the case. There's so many other reasons. So when you have inadequate sleep, they don't play outside because of, again, a lot of other reasons, and they're not eating balanced meals. That comes together and results in a teenager who's shorter than what they're supposed to be.
Okay.
So-
But doctor, actually, I have something that I really want to ask because this is something that my mom, not my mom, but I think some of the family members have actually mentioned about this. This is actually like, I wouldn't say it's a taboo thing, but I think it's like a misconception. Do you know the monkey bars at the playground? You know, people usually say if you go and hang yourself on there, if you play them more often, you do like push-ups or pull-ups or anything,
Yeah.
whatever not, you usually can get taller. Is that true?
Well, if you're hanging on the monkey bar, you're going to pull on your socket.
Right.
It's not going to hurt you if you do it properly. But what you're actually doing is exercising, which is one of the important components for healthy growth. So it's not the monkey bars that's making you long. Otherwise, your arms will be long.
Yeah.
If you hang upside down, then your legs are going to be long. Right? But you're exercising. You're actually burning energy. You're actually getting that heart rate up, sweating it out. And then when the time you go back home, you're going to be hungry and you're going to eat more. And hungry children are less picky.
Yep.
I'm hungry, Mom. I need to eat. And that's the time when you can give them just about anything, they will eat. So yes, monkey bars indirectly may contribute to growth and height, but it is not through lengthening of your joints. It is through exercise.
You know, because it's always been said, go hang in the monkey bars at the playground so that you can get taller. I'm not sure if you've heard of that, NABIL.
Yeah, I have
Yeah.
heard of it. I
Yeah.
have spent so many hours
Hanging.
at the
You
monkey bars when I
have?
was young.
Oh no!
If only I knew. No wonder my arms are long now. But yeah, thank you for clearing that up. But yeah, I have to say, because okay, obviously, like I said, that I'm not very tall. I've lived my life, all 33 years of my life being 163 centimeters. But I don't see that being much of a problem,
Yep.
doctor, to be honest. I mean, things are okay with me. I'm fine so far. So I wonder, are there any negative or any kind of implications on stunting on children or teenagers?
Studies have shown that children who do not attain good adult height
Right.
fare worse compared to those who do in terms of economic growth. That means their final income and their education. But it is not to do with your height. It doesn't mean that if you're short, you can't do well in university. It has to do with what contributed to you being short. So if it was some micronutrient deficiencies, some nutritional deficiencies, or if you were sickly as a child and you did not go to school quite as often as you should have because of your ill health, or if you're not getting enough iron, then your brain's not going to be adequately developed to absorb all the lessons that you've been taught. And that can translate into poorer educational outcome, and that will in turn translate into poorer income. So it's not like if you're short, you're unsuccessful, if you're tall, you're successful, no. But the reason for not growing can be the cause of you not being successful in life, or not doing as well as you should have.
And psychological too.
Yeah.
It's a psychological because, you know, you get picked or don't get picked.
That is
Yes.
Based
true.
on your height.
That is true, correct.
You're set in front instead of behind.
For example, if you're playing sports or playing netball or anything like that, yeah. I mean, the height is a factor if you think about it.
For certain careers
Yes.
too, right? Certain careers, certain rights. If you go to the
Theme park.
theme park
Yeah.
and stuff like that, so it does affect a child to some extent. We don't know, but the child is affected. You know, and immunity, back to that, immunity, the IQ, and all are affected.
That's to do with the nutrition.
Yes.
Yeah.
If it is malnutrition or undernutrition that's resulted in the person not attaining the potential height, then that will have an effect on the child's brain development.
Okay, so we're actually almost out of time. But then again, it's a very interesting topic. I never thought we would really go much deeper into this discussion. So I just want to touch a bit because I don't want to have miss the chance of not talking about it.
Yes.
So please tell us more about the I Am Fat Growth 2023 program. I'm sure you guys have a bit of a sharing for us as well.
Yeah. Okay, the Growth 2023 program is something that we just launched. It's targeted at identifying and managing stunting. That means children who are not attaining their growth potential. And by doing so, I mean, in trying to achieve this, what the Malaysian Paediatric Association has done is to collaborate with various other associations, namely the Family Medicine Specialist Association of Malaysia, the Malaysian Medical Association, because this covers the GPs as well as family medicine specialists, and also Persatuan Tadika Malaysia and Persatuan Pengasuh Berdaftar Malaysia, so that we can empower the kindergarten teachers and the preschool teachers to monitor and alert the parents on their children's growth. At the same time, because we need parents to be aware of the implication and to be aware that stunting can be a problem, we are also providing parent forum on our website, iamfat.my, and they can go there and participate in these forums and learn more about stunting, its causes, and how to manage. Parents can also visit the I Am Fat clinics, which are available around the country, and have their children assessed. And upon assessment, they can consult the I Am Fat doctors on how to go about managing this problem. So it's not just about talking about it on, on social media and on TV, but we also want to go down to the ground level. We want to empower teachers as well as parents to monitor their children's growth, to come forward, to ask questions, to rectify problems if there are any. And they can get their information by visiting the website and attending these public forums.
Awesome. iamfat.my, ladies and gentlemen. Make sure you guys check that out. I'm pretty sure after what we have discussed, maybe parents at home might have a bit of a concern or whatever not. Just lastly, before we go, maybe you can tell us how parents can seek help from the both of you for any inquiries that they might have about their children.
Well, when they visit the doctors, if the children are still getting the vaccination and the children are still young, it is routine for us to take the height and the weight, or the length if they're under 2 years of age.
Or where they can find you, doctor, actually.
They can actually look for us on the I Am Fat website. They can Google for I Am Fat clinics, and there will be a list of doctors who are registered with I Am Fat. If there are no clinics in their vicinity, they can always go to a nearby clinic and get the height and weight measured, and then ask for one that's closer to them, if that's a problem. And we tend to refer to Ms. ROZANNA or other dietitians to work out the diet. Parents can also reach the dietitians through the hospitals or the centres where they're based.
Okay.
Ms. ROZANNA?
Yes, normally the doctors assess, then doctors monitor, then they will refer to a dietitian.
Dr. YONG, then we'll
yourself.
go to
Yes.
In my hospital.
Awesome. All right.
Thank you so much. Apologize because we don't have time. I wish we could talk about this for longer, but I mean, there are we have a lot of questions and we just don't have enough time. But we really, really appreciate you coming here on a Sunday morning to talk about this with us and obviously spreading awareness about stunting in children and also teenagers. So thank you so much again, Dr. Yong, JUNINA, FADZIL, and also ROZANNA M. Rosli.
Thank you so much. Thank you.